Hello, everyone. How y'all doing today? Thank you for joining the HCM 340 live lecture. My name is Katina Flagg. I will be hosting this session today. This session is designed with you in mind. We just want to let you all know we are here partnering with you. These allergies are bothering me today. I'll just turn on my camera briefly so y'all can see that I am actually a real person, and then I will go ahead and take the camera back off. And today, we're going to go ahead and walk through the chapter 1 introduction PowerPoint. Let's see. I see someone has something in the chat box. Oh, good afternoon. Thank you. Someone is typing in the chat box. Before we get started, and I generally stop about 5 minutes early because I have a course right after this one. So if you have any questions, I just want you to know that this is free for you guys to ask questions. I'm here to offer you support. If there's anything that I can do or to support your success throughout the course, that's what I'm here for. I see Rachel's typing, so just as soon as she's done, we'll go ahead and jump in. Better than AI. Yeah, I'm a real person. You see behind the scenes. Um, and that's why we want to, be here for you all, let you know that it's really someone here behind, these courses, and we've actually gone through the same things that you've gone through. I took a lot of courses online, and to know that there's a real person is it's helpful. And a lot of things are moving toward AI, but this as new. No, we're not AI driven. We are real people. So before we get started, does anyone have questions about this particular course? No questions about the course? Okay. The healthcare delivery system. So oftentimes, when people look at this class HCM 340, the healthcare delivery systems course, you know, they get confused. What you think about when you think about a healthcare delivery system, it's the whole, how, is the healthcare delivered. So we'll do an introduction today. Can you change your resources? Rachel, you can unmute your mic and let me hear, what do you mean change the resources?
Can you hear me now?
Yes.
Oh, so sorry. My computer's lagging, and I'm so sorry. It's
Oh,
catching
it's
up with
okay.
me.
That's
Um,
okay.
so so when I did my annotated resources on this last paper, I was just curious to know if we found a better resource for our final paper, if we can use those, or are we just in practice with those?
Oh no, you can use it. The better resources are welcome. You know, just make sure that
Okay.
all of your resources are from collegiate level, right?
Right.
Source, no Wikipedia, or those sorts of things. But yes, if you find great resources, journals, articles, those sorts of things, or books, then we welcome those
Books, but
resources.
So the books is what got me because I was looking up on Shapiro Library for good resources for books and such. And even though I'm in healthcare, I don't really get a lot of books to read. Is there like a certain page or site on the Shapiro Library, or should I just contact the librarian? I
The
have never had
library,
to do that before.
yeah, the librarian would be your best source. As far as when you're looking through the Shapiro Library, they can help
Right.
navigate. That's their strong suit. So, that's I would recommend you reaching out to them, scheduling an appointment or something like that, so that they can help you navigate if it's something course specific or title specific that you're looking for.
Okay, perfect. Thank you so much. I appreciate that. I think that was my last question.
Oh, it's okay. Thank you. So when we look at the healthcare delivery system, the definition of healthcare delivery system is often confusing to many. It's all persons, institutions, and processes supporting the diagnosis and treatment of health problems. And for is legitimized patients by its appropriate providers. So it when you look at a healthcare delivery system, it's not just a computer, it's the whole concept from start to finish, how that healthcare is delivered, how that patient is being treated, what those workflows are. Okay. So there's a variation among national healthcare systems, right? So you have your definition of health problems. We have our diagnosis and treatment models. We have our social positions. We have training, and we have authority of healers. So when you're looking at your healthcare delivery system, it's a combination of many things put together to ensure that the patients have adequate healthcare delivered by the providers within a certain scope, and that they are treating the patients accordingly. When we look at a home health, many of us may have uh, utilized a home health or heard about it through our family members. And what is home health? It's a complete physical, mental, and social well being. Okay. And so, who generally utilizes home health? We have, various stakeholders. For instance, a year and a half ago, my father fell. He broke his hip. He had to have hip, replacement surgery. He survived, but he had to come home with home health. So you have stakeholders with various diagnoses utilizing, you know, oh wait, this isn't home health. This is health and healthcare. Well, still same difference because it's talking about the physical, right? um you have that physical component to it, like what can they do. You have that social component to it, what can they do. So when you look at your genetic, your health, your physical, and your social environment, all of these things play a vital role in your health care. So like even for example with my father, we had home health. He has a home-based healthcare team, meaning his provider, his social worker, at the time, his physical therapist and occupational therapist came in the home to provide those treatments. So we were looking at his social well-being, his physical well-being, his health behavior, and we didn't have any genetic issues going on there. But we had the ability to look at his care holistically and get the best team in place to nurse him back to good health. So that was something when you look at the healthcare delivery system, this will be an example of a successful outcome. Any questions or comments? I see Rachel typing. Yes, it is mostly the elderly. But when you look at too, you look at some veterans, they use home health as well, and they could be of all ages. So sometimes individuals, have PTSD for various things and they don't want to go out. And with the military, they do have the home-based healthcare platform, and that works for them. So you do have various types, right? Um, when you look at health behavior, stakeholders with PTSD or some other diagnosis may suffer from smoking disorder, alcohol or drug abuse, diet or exercise. Well, are some of those health behaviors that are not the best practice, are they contributed from um, other, social stat issues? Did they experience something traumatic that warrant them to drink? Did they experience something traumatic that warrant them to eat too much? So those are some of the things that people can analyze and put processes in place to help stakeholders, deal with those comorbidities. So when we look at, what's implicated in leading cause of death in the United States, well, heart disease, hypertension, cancer, stroke, respiratory diseases, pulmonary hypertension. How many of you all know about pulmonary hypertension? Had anyone ever heard of it before? Yeah. So pulmonary hypertension, like we all know that hypertension is a silent killer, right? Well, pulmonary hypertension is worse. So because you don't have like spikes in your blood pressure, it actually renal hypertension, I'm sorry, it actually impact your kidneys. Renal hypertension, it impacts your kidneys. And when you find out you have hypertension, it's because your kidneys are failing, and then you have to go pretty much on dialysis. So those are some of the things, like that's why it's important to get routine checkups. Okay. And generally it can impact people like that has clogged arteries because they smoke. Some people that don't ever drink, they don't have, liver issues, but they may have renal issues. So we just have various diagnoses and those sorts of things that impact stakeholders. But it's good to understand the whole health of an individual. So when you may hear a lot right now in the media, you hear them talking about social determinants of health. And healthcare has a determinant of health. The main goals of healthcare is to restore the health and to prevent the worsening of problems. So that's the reason why you see a lot of stakeholders, they offer HMOs, right? So HMO is a preventative maintenance program, and it's designed to, work to restore the health, and then a preventative type of measure versus, um, you know, not maintaining a quality life. So that's why you have one provider assigned to you. That one provider is assigned so that um, they can maintain your health and try to keep you healthy. Does that make sense? Any questions about that? So and if you look at that, we have levels of prevention. You have your primary level, you have your secondary level, and you have your uh, tertiary area, the third area. So you have three different models when we're looking at trying to keep and maintain someone healthy. Our healthcare system is complex and it's unique among nations. It's highly decentralized and fragmented. So, just like in Canada, their healthcare is more centralized platform. We have decentralized. We have our HMOs, we have our PPOs, we have our POS, and it's not the same healthcare platform across the board. While we do have various components of the healthcare program to try and help us, have a certain level of maintain a certain level of our healthcare, it is decentralized, right? We have our mix of our private and public financing. You have financing at your state and local levels when we look at our healthcare delivery system. So it varies, right? And then, so historically, it has produced high physician incomes and profits for suppliers of medical products. Well, with the HMO, we do have some control over, that reimbursement. Physicians are reimbursed based on their RVUs, their relative value units. Um, Physician reimbursement is calculated based on geographical area. So, for instance, in Texas, just say the provider may get paid $30 for a lab test, where in California, they may get paid $80 for that same lab test. But the equivalency of their reimbursement are the same. It's because the cost of living in California is higher, so their RVUs are a little bit higher than the ones in Texas, but they're ultimately getting paid the same rate for those particular procedures. Does that make sense? Questions, comments? Okay, thank you. When you look at your components, you have your workforce development team. That's about 12.7 million people. I'm saying dollars. Your facilities that where the healthcare services are delivered. You have your ambulatory and your inpatient facilities. Another component are your medical products. You have your pharmaceuticals, your durable medical equipment, and non-durable supplies. You have your training and research. These contribute to the quality, innovation, and the innovation of healthcare systems. And then you have your financing. It's about 3.4 trillion, and this was in 2017. And so um, data it usually takes. We report like 3 years behind. So the updated data right now, we're going into like 2024. So we would start seeing data come out in the next update about it'll be about 2021. So I could tell you the financing of healthcare in 2017 was $3.49 trillion dollars. So with 2020, with COVID and all of that, you can imagine how expensive healthcare is today. So the price of healthcare is continuously rising, and we have to do what we can to maintain um, adequate health care at a reasonable rate. So you often see if you all are working in the healthcare setting, you will see budget cuts. They look at ways how they can trim the fat. They look at the physician's documentation to make sure that they're adequately documenting and reporting the care and treatment provided to these patients. They're actually reporting the severity of these patients so that they can maximize their reimbursement. They're not trying to overcharge. They're just trying to get reimbursed for the services and treatments that were rendered at an adequate rate. Does that make sense? Questions, comments, or concerns? Thank you. So when you're doing your assignments, you're completing your assignments, just make sure that you're taking a deep dive and you're digging in deep to tell a story or paint a picture, if that makes sense. And so when we look at the organizations of healthcare services, you have your government sector. You have the federal, state, and local governments. One second, please. Okay. So we have healthcare, federal, state, and local, right? Reimbursement comes from those various venues. You have your Department of Health and Human Services. They help with, and CMS with rules and regs. You have your federal registry that also have guidelines. Some of the reimbursement for stakeholders that are on Medicaid, it comes from various, your state and federal government. So just like Medicare in Texas is called Medicare, that's at the state level. In California, it's called Medi-Cal. So the revenue to come to pay for that comes from your federal and your state um, areas, right? And then you have different things from your local government. Then when we look at our private, nonprofit sectors, many hospitals and voluntary agencies such as the American Heart Association and Red Cross fall under your private or nonprofit sectors. So you have some hospitals that are not for profit, but they still earn revenue. Now, when you have facilities that's not for profit that are healthcare organizations, but they still earn revenue, what happens in those sets is they have to like give away a certain amount of health care to indigent patients. So they have to write some of those claims off. But it all has to be published so that everyone get the same opportunity at that healthcare service. So if they're going to have, if they're a not-for-profit organization and they are responsible to give a certain, set of patients a break due to their financial class, they still have to offer it to everyone, and everyone has to meet that criteria. Okay. So when you look at private for sector, um, you have your pharmaceutical sales, you have your drug reps. So all pharmacy companies are out for profit. I have not seen one nonprofit organization that was a pharmaceutical sale, but I'm not saying there's not one out there. I just hadn't seen it. I've been in healthcare for almost 40 years now. But you never know, right? Because no one person knows everything. Any questions or comments? So here is you just have your different types of health care. You have your primary care, secondary care, and I can never get that out anyway, care. These are various types of services and treatments that are rendered. So for instance, if you have just your routine immunizations, that's your primary care, your physician, you go there, you have these treatment and services rendered. If you have a surgical procedure schedule or a diagnostic test, it could be inpatient or outpatient. That's your secondary care. And then a third level of care would be your organ transplants, open heart surgeries, or chemotherapy. So sometimes even with the transplant transplants, they may have people, for example, someone needs a kidney. Just say if my son need a kidney, I wasn't his match, but someone else was his match, they would do kidney swap, right? So they would test me. I would give up one of my organs and give someone else an opportunity at life, and someone else would give up one of their organs and give my child an opportunity at life. That's called kidney swapping, right? So that they're testing all across and find matches, because you have to go on those donor lists. And if you don't have a match, your life could be limited. But if they find someone, families or stakeholders to swap so that you could save their life, and like me, I could be perfectly healthy, nothing is wrong with me, and so I can give my kidney to someone else. My son couldn't use my kidney, but maybe someone else could. So those are some of the things that we can do in healthcare today. Like I said, we have 5 minutes left. I want to ask, is there any questions, comments, or concerns? As you all know, I have another lecture right after this one. So I just wanted to have this last 5 minutes to answer questions if I need to, before we jump off. If you have any questions about the homework assignments or anything like that. Your final, you already asked great questions about the research topics. Um, I see someone typing in the chat box. When you say the efficiency of healthcare, um, Medina, will you unmute your mic so we can collaborate about that? I just want to understand the angle in that question. Are you talking about the quality when you say efficiency, like how we have policies and procedures in place to make sure that we're delivering the appropriate amount of health care and that is safe with that safety mechanism?
Hi, can you hear me?
Yes.
Hi. I know like our milestone that's coming up in our module 3. I'm doing the gap between the older generation and the it's just kind of hard to describe the efficiency.
So you meaning from the way healthcare delivery was delivered,
Yeah.
let's say 20 years ago to today. Well, you have to think medicine, we have modern medicine today. Like we have a lot of research, we have a lot of scientific studies behind the treatment and services that are rendered. We have robotic, operations. We have laparoscopic procedures. And the whole thing about the laparoscopic and robotic procedures, it supports the fact that faster recovery time, less infections. That's an efficiency when you look at healthcare and surgery. So before, example, if a lady had a hysterectomy, she had to stay in the hospital the way they used to cut and do those surgeries, 2 and 3 weeks recovery time. Well, now they could do a laparoscopic hysterectomy. It could be a vaginal, it could be through the navel, or it depends on how large the tumor is. It could be a cut. But if it's a vaginal, hysterectomy is like a laparoscopic procedure. It's much more efficient because they go through the vagina, they pull out whatever they need, partial or full hysterectomy. She recover. She the next day she's out, and in 6 weeks she's back to work. Well, that's now, it used to be longer many years ago. So those are some of the things that has been put in place with advanced technology to make healthcare more robust. Is that an example that can help you see how efficient things can be now versus before?
Yeah, it's funny because I actually work in surgery, so definitely explains it. So we're just trying to explain it,
Yes,
pretty much that
yes,
gap. Okay.
yes, yes. Because you remember back in the day, there used to be a lot of like, okay, another good one. You work in surgery, right?
Mm-hmm.
Remember back in the day before they had like, I can't think of what we call it right now, but they check before they close the patient up to make sure that all of the instruments and everything are out. They used to leave instruments and they used to leave gauze and all of those things in patients all the time. But now a surgical case is more efficient because before they close the patient up, they count every piece of equipment. The sterilization techniques that they have now are more robust, so you have less infections and those sorts of things. So you don't have patients with needles and gauze and all of those things left in them, syringes like they used to many years ago. So those are some of the things that they've done with advanced technology and advanced systems in place to make things more efficient and more robust.
So thank you so much.
Yeah,
Definitely helps me.
great, great. Great question. Thank you. I see Rachel typing. Oh, yep, hopefully it's there. I have this the last question. I'll take Rachel's question, then we'll have to jump off so I can log into the next course.
I'm sorry, I don't have any questions. My computer's lagging, so it just keeps typing little things in there. So sorry.
Oh, no problem. Well, thank you all for
Thank you.
joining. This was great. If y'all have any questions, you can reach out to myself or your primary instructor. Thank you all and have a great night. Good night. Bye bye.
Stop it. Just stop it.
Hello, good evening. How y'all doing? Think we had a little mix up with the stop recording and transcript. No. Oh, so what happened was it seemed I have two lectures back to back, and it seemed like this lecture for HCM 345, the HCM 3, well, it was just confusion. My apologies. Anyway, how y'all doing today? We have about a few minutes left in this section. Just wanted to jump on. My boss did ping me and let me know that you guys were still sitting over here waiting. I'm in another link waiting for you all, but nevertheless, we're here. Do y'all have any questions or comments that I can assist you with tonight about your course, your intro to healthcare finance course? Okay. Well, I'll just jump in and go through a few of the slides. If y'all have any questions, please don't hesitate to reach out. I apologize about the confusion. I think that the link was mixed up. Okay, so I think that's what happened. I was the instructor that jumped off this link to go into another link, and then I was just redirected over here to say you guys were here. So thank you for joining. So in healthcare finance, I mean, as you all know, healthcare, it has evolved over the years, right? So now we have, back in the day when healthcare first started, well, not when it first started, but prior to health insurance, many physicians were taking care of other physicians' families, and that's how they kind of kept healthcare affordable. That was the affordable healthcare. But now today we have, governmental plans, we have um federal plans, we have third party employer plans. So complex is evolved from patients paying cash to having this health insurance, and then the complexities of the financial institutions. So now the patients receive services, there's a cost benefit to it, it's a risk, of sharing those costs. So now we have our HMOs and our PPOs and our POS plans that are offered. When we look at this, we have different accounting authorities. We have the Federal Accounting Standards Advisory Board. The characteristics of this particular board is an independent organization, and it serves the public interest. It looks to improve federal financial reporting, and it sets the standards for businesses. It also improves the financial reporting by a comprehensive study of issues using an independent and comprehensive process, weighing the costs and the benefits of financial reporting and being accountable through transparency. And so what that means is, when they're accountable through transparency, as you all know, we have the auditors that come in and audit the books. They want to make sure that the costs are fair, the patients are receiving their EOBs, the insurance companies are receiving explanation of benefit, remittance advice. So this is how we keep that cost component transparent. Does that make sense to everyone?
Yes.
Any questions about that?
No.
I see Stacy's typing. 1 second. Okay, thank you, Stacy. So when we look at generally, you have the gap. It's the generally accepted accounting principle. The principles that are used in the preparation of your financial reports, your statement for businesses or entities. And so when you look at this, we have um, CFOs, right? Our chief financial officers. They all have guiding principles that they have to follow. Those stakeholders are in place to ensure that the organizations are ran well, that they're have financial discipline, that they're getting the best for the organization and they're not misusing funds, right? So that's where that financial reporting come in. They have those statements where we can track everything. Across every dime that's spent throughout the organization. That's what that CFO is responsible to make sure that we making good business decisions. The gap is also set is a set of principles that shape the preparation of the primary set of financial statements. So you have your cost analysis. You have all of your various types of financial forms for us to balance and audit, right? You have the two categories of accounting principles. You have your recognition and you have your disclosure. So there's two different types of accounting principles there. So you have your financial reports and you have your accounting principles. And then if they have another added layer in there, if they're receiving federal funds from grants, then you have that granting accounting system. You have your GL codes. You have your various types of codes to make sure that the money and the classifications are appropriate when they're looking at budget, right? Because the expenditures, make sure you're not spending too much money. If you have a large budget and you don't spend it, they may reduce your budget by 10%. That's what they use all of those reports for. You have your securities and exchange, right? Um, it protects the investors. It maintains a fair and efficient market, right? So you don't want people to go in and like run the market up and then knowing what's going on and then they cash out all and they buy like millions of dollars worth of a stock or something and then they cash it out. That's fraud, right? So that's why we have these various rules in place. Does that make sense to everyone? Any questions? So I know you guys heard about the whole Madoff thing back with that Securities and Exchange Commission. That's the reason you have these type of entities in place is to make sure we can protect the investors, make sure that the market stays solid, make sure that it doesn't crash, that it has a good financial health. Okay. So the SEC enforces laws to protect against the corporation and individuals that violate the laws that include insider trading. So insider trading could be even you could do insider trading. You hear of something that's going well or these various changes and you start having discussions with stakeholders that don't have a need to know. They go in and start buying up a bunch of stock. That's insider trading. Okay. You have to do fraud, providing misleading information. This is what the SEC protects us against. Um, it works closely with the Congress, the federal agencies, the stock exchange, and the state securities regulators. So we have a lot of rules and regulations in place. And it's very important that we follow those guidelines to make sure that we're not committing fraud or abuse. Any questions or comments? Additional accounting authorities, we are all too familiar with the Internal Revenue Services. We know that it's a very rapid, robust, and charge-filled environment. This is also a place where, people commit the most fraud because they don't want to pay those taxes back. They don't have enough taxes out taken out their check. They have business taxes, they have personal taxes, and there are tax laws and that we should all go to a professional to prepare our taxes to make sure that we don't get in trouble. Right now, The IRS is important. People are trying to avoid taxes. They're filing deductions and everything that they are not that they should not receive, and they're going to prosecute. There's some messaging going out right now. So it's important to make sure that you're following those guidelines appropriately, that you seek the correct counsel. I can never give anyone any tax advice because um that's not my expertise, right? Do you have any questions or concerns? Do you have any assignment questions before? And I know there was a little confusion, and I apologize about that. But before we jump off, do y'all have any assignment questions? Anything specific that I can help you with pertaining to the course? No? Okay, if not, I apologize. We'll get the links and everything all straight for the next um live session and make sure that they're not crossed up. And if you have any questions for me or your instructor, please don't hesitate to reach out. But thank you for joining, and I apologize for the mix up with the links. If not, y'all have a great day. Thank you.
Thank you.
Mm-hmm.